Hello everyone. A very good afternoon to you all. Myself, Dr. Sumedha Gupta, and I would like to welcome all our viewers who have joined us today for this insightful episode, which is named as The Big Idea Voicing What's Next in Healthcare, presented by VOH. This episode is a mini virtual series, insightful interview series where we feature leading healthcare experts and innovators who are making significant impact in the healthcare space. Join us as we'll be delving into their insightful experiences. And to mark this, today we have a very special guest joining us who is the visionary founder and CEO of Ayush Pay, a groundbreaking platform dedicated to ensuring every Indian can access healthcare without financial constraints. Alongside, he is also a founder of World Health Group, which offer essential supports including food and other necessities to those who need globally. And top of it, Mr. Agarwal has been honored with the prestigious International Award for Innovation and Science Projects from APJ Abdul Kalam. Hi, Mr. Nimith Agrawal. Welcome to our show. How are you?
Thank you, Dr. Sumedha. Thank you for inviting me. Hello, everyone. Happy to speak whatever you ask me and wherever I can help.
Yeah. Looking forward. Before delving directly into the discussion, first I would like to ask about your journey, like how it started to be an entrepreneur in the healthcare space.
In healthcare space, so by default, entrepreneurship is in, I think, in DNA. Blood baniya hu, to I think that is in the DNA. I come from Varanasi, a regular middle class family. I'm a civil engineer by profession.
Mm-hmm.
Uh, Unfortunately, we also in my family we had a medical scare, uh, because of which we have seen financial, emotional challenge right from like very childhood. I've seen it like 5, 6 year of age, and that is actually what drives me because it's very personal to me. It's very near for. It's very very personal to me, and that is what drives me to solve what I have been seeing since childhood and even today. And I think this is because of this, this has become my passion. And obviously I've built a profitable business in past, so the DNA is around building a sustainable, long term sustainable business rather than 2 year 3 year old, just uh, a blip and then whoosh. So we have been trying to marry profit with impact, so that we can also make a build a profitable sustainable business while at the same time build a impactful affordable healthcare for the masses.
Great. So you are a visionary founder of Ayush Pay. So I would like to ask, like, what motivated you to create Ayush Pay, and how the company's mission evolved to better address society needs and challenges.
So Ayush Pay was, we started it 3 years ago. As I told you, this was because of my personal family circumstances, which brought me into healthcare, which made me see healthcare right since 5, 6 year old age, as an attendant, as a caregiver, and the challenges which I was seeing since childhood, not only with my family, because when you go to hospital, you see other families also, you see people
Mm-hmm.
talking, people addressing their challenges, and I have been trained, I've been taught to be intuitive, and that obviously that was there, and that made me start Ayush Pay. Ayush Pay today, what it is, it's not what I started with. We started with a very different thing 3 years ago, uh, and with a lot of pilots, a lot of experiments, we have been able to create MVP or product market fit for Ayush for us, and yeah.
So would you like to share more about Ayush Pay, like how it serves people and what is the vision behind it, and how it is like going?
So Ayush Pay, what we are doing at Ayush Pay is we are trying to build affordable healthcare ecosystem. Uh, as everyone us here know, almost 50% of Indian pays for out of pocket for their healthcare treatment, and
Yeah.
that creates a lot of stress in the family. uh, Niti Ayog recently spoke about the missing middle. There are almost 50 crore people covered under Ayushman Bharat and other various government scheme, and then 12-14 crore covered under retail and corporate insurance. But then there are for 50 to 60 crore Indians who do not have any kind of insurance, whether it is government or private. And this is what missing middle is. Usually lower middle class and middle class come under this category, and they don't have enough time to go and wait in government healthcare facilities, and they don't have enough money available with them to go into private healthcare facilities. And that's why you would hear 7% middle class goes below poverty line every year because of healthcare challenges. So this is what we were trying to solve, and we saw a huge irony in India, where I can buy an iPhone or a laptop at 0% interest, but when I have to take medical loan, I end up paying 30%, 40%, 20%, whatever my credit parameters are. It's a very high interest rate on my medical treatments. And this is what we want to solve. So at Ayush Pay, you can access to affordable healthcare in our partner network hospitals. And this affordable healthcare, it's not just about giving you the interest amount. So one, obviously, this interest component, when I'm talking about 20 to 40%, this itself is 2 to 3 months salary of an individual. So one, we end up saving that 2 to 3 months salary, and it's a very big amount. 2 to 3 months salary for anybody is a big amount, no matter what amount money is that person is earning. So we end up saving that 2 to 3 months salary. On top of it, uh, the healthcare journey, the treatment, it's also very controlled quality care which is being given to you. So if you go to our network hospital, one, you won't be charged differential monies, you won't be charged basis of your paying capacity. It's a very prefixed negotiated prices with the hospital. The treatment during the whole complete journey of the treatment, Ayush Pay's tech is there, Ayush Pay's team is there. From the medical protocol point of view, we keep an eye on what kind of treatment was supposed to be given, and is there any fishy, which usually do not happen, but if there is,
Mhm.
then we keep an eye on it, so that one consumer can access an affordable healthcare, but also at the same time can also avail a quality healthcare. So we are merging quality healthcare with affordability, so that most of us who avoid surgeries, who avoid treatment because of lack of money, कि बाद में करा लेंगे, 3 महीने बाद करा लेंगे, 6 महीने बाद करा लेंगे. A
Yeah,
lot of
yeah.
times what happens, gallbladder stones, which are very small, very common disease, gets converted into cancer also, because वो आप टाल रहे होते हो, because one, either you do not have money or you do not have time, and in most of the cases you do not have both. So you try to avoid it, and there are a lot of such disease, appendix, there are a lot of such disease, which cataract, it's a very common disease, and most of the people delay it as much as possible because of the money. So this is what we are solving, and that's what we are trying to solve for the major regions.
Yeah, I think you have said it right. So while I was practicing in hospital, I have seen people who are delaying these kind of surgeries and treatments due to lack of money, due to lack of time. And I think this is the biggest challenge in healthcare if I talk about the treatment and providing services. So I just want to know, like, how does Ayush Pay contribute to improving healthcare experience for underserved, or I would say marginal communities or lower middle class people, and what has been the feedback and experiences you guys have received from these communities?
So as I said, one is obviously you get access to credit. When I was saying 5% per month or 10% per month पे लोन मिलता है, तो यहाँ पे बैंक से सस्ता लोन मिलता है. One is that. So either आपको 0% interest पे मिलेगा, और at best बैंक से सस्ता मिलेगा. So one is that, without having to roam around, without having to really plead for money, you will get access to funds. In a lot of cases, so we have two journeys. One is you need money immediately, we give you funds, or you can't afford health insurance, we give you a credit line, pre-approved credit line. So you do not need to even worry about anything. You just walk into our network hospital and you get your treatment. It's as smooth as insurance, actually better. Insurance में आपको प्री अप्रूवल एंड पोस्ट अप्रूवल के लिए वेट करना पड़ता है, यहाँ पे वो भी नहीं करना पड़ता है. तो it's smoother than insurance, if I say so. And as I said, you end up saving 2 month 3 month salary on the interest component, plus the quality is also being controlled at the back end. So whatever treatment is you are undergoing through, when you are a Ayush Pays patient to our network hospital, every prescription, every charting is being reviewed through our tech and being flagged if something is not right from protocol point of view. So that our patient are not taken for a ride when they are in a hospital. From feedback point of view, this is very interesting. You won't believe, a lot of time, mm, some of the patient have reached out to me via my call center. They requested, and my call center gave my number, and then they reached out to me. And it has been so emotionally confidence building, as well as feel good factor, but at the same time also encourages me to work more on this, because I've heard people crying. I've heard people very obliged, crying in like happy tears, that they were able to get help when they needed it the most. And मार्केट में उनको इतने महंगे लोन मिल रहे थे, और बैंक से भी सस्ता मिल गया यार, 0% इंटरेस्ट पे मिल गया, विच विल सेव लॉट ऑफ देयर मनी. सो मे बी हमारे लिए 30-40 हज़ार रुपये कुछ नहीं होता है, बट फॉर द
Yeah.
masses, फॉर मिडिल क्लास, 30-40 thousand rupees going just from interest point of view, it's a huge amount. उससे coming out of that spend of expense of 30-40 thousand rupees takes a lot of time. पहले ही से हेल्थ केयर का कॉस्ट एडेड है, उसके ऊपर से इंटरेस्ट का कॉस्ट रियली किल्स यू. एंड लॉट ऑफ टाइम, चूंकि इंश्योरेंस नहीं होता, एज आई सेड, सो यू डू नॉट हैव इंश्योरेंस, यू हैव सेव्ड ऑन इंटरेस्ट, इंश्योरेंस मनी, you have saved on interest, and also you've gotten treatment, preferred treatment, you've gotten affordable treatment at the time of at the time of need. And that I can't express that emotion which with which when they call and they express their gratitude toward what we are doing. And actually that forces me to work more, and reach out to more and more people as fast as I can. And while I'm saying this, that I usually end up saving that insurance premium, but at the same time, I'll say insurance is good. One should buy insurance, but one should not buy insurance just for the sake of it. So a lot of time people buy a very small 1 lakh, 2 lakh insurance.
Mm-hmm.
Then it usually do not make sense financially. Do not make sense. Obviously, everybody cannot afford a large sum insured, but if you can do buy a large sum insured insurance rather than 2-3 lakh rupees, yeah.
Yeah, and I think Ayush Pay, the services which Ayush Pay is providing, I think it's great because direct services are good, but you guys have become the mediator to ensure that one should get the great services the way they want, the way they deserve. So yeah, I think it's great. It's going great. And
Thank
on top of it, I would like to ask, like, what was the most significant challenge that Ayushpay has faced in expanding its reach to the various communities? Like, क्या strategies थी? What strategies you implemented to overcome such obstacles during
आप
the
तो
whole
गो टू
journey?
मार्केट पूछ रहे हो और आस्किंग मी माय गो टू मार्केट. ठीक है, I'll divulge what I can. But from challenge point of view, like we were speaking, discussing that healthcare has always been a very difficult category to scale. Very, very difficult categories to scale, because I have seen startups. It's called graveyard of startup. Healthcare as a category, while it makes so much sense कि healthcare is such a large market, such so underserved, everything is there, but still it has always been a graveyard of startup. uh, People have not been able to crack it. In healthcare finance, there have been companies in the past, there are companies at present. People have not been able to crack it. We took sweet 3 years for us also. It took a lot of pivots, a lot of experiment, constant pivot. The things which worked in our favor is obviously we one had Colonel Hemraj, who is a healthcare experience professional, a very senior leader, uh, and on top of it, usually what we as a founder do it, since we live in cities like Delhi, Bangalore, Mumbai, we see it from that lens, and that creates a challenge because challenges at Medanta versus challenge at a 20-bed hospital is very different. It's a very, very different
Yeah.
challenges. Both are very consumer going to Medanta versus a patient going to a small hospital. The challenge is very different. Thankfully, we experimented in tier one, two, three, four, all these cities from Medantas to a 20-bed hospital in last 3 years, and it was draining, but that gave us what we are today. While we are not present in the media, we are not present in on LinkedIn much, and I think that is by choice. But whatever we have been able to build today, whatever go to market, whatever scale we have been able to achieve, or what scale we are about to achieve, is because of a lot of experiment. It's a 3 year relentless pivot experiment, and testing, trying across all these tier one to tier four cities, from upper middle class to lower middle class consumer base, and that's how we have been able to overcome these obstacles. Can't give you strategies, but yeah, that's what it takes to solve a challenge which is not being solved.
No, no, I think it's very insightful. And so, if I talk about the social impact and the differentiation, so I would like to know like how you stand out in the commitment to social impact compared to other healthcare payment solutions, and like how do you plan to strengthen these aspects for your business and for the community?
So, from awareness point of view, and from differentiate social impact and differentiation point of view, we have been, as I told you, we have been focusing on missing middle. The whole focus is around missing middle, and when we are talking about missing middle, it is not, as I said, it is not in tier 1 city, it is also there in tier 2 city, it is also there in tier 3 cities. And it is not just about money, it is about quality healthcare also, it is about going to a right hospital, going to a right doctor also. And that's so we are not a mediator, if I say so. We are more like a tech platform, healthcare platform, which gives you a bundled program where you do not only get an affordable healthcare, you also get an quality healthcare. A controlled quality healthcare is what you get at the end of the tunnel. And going forward is just to strengthen this further, to take it to 1,000 cities and scale it for as many people as possible. And our whole DNA is around social impact. So whenever at Ayush Pay, whenever, and you can take this interview from any of our employee without me being involved, you will find one thing, which is in the core DNA of Ayush Pay, is that whatever we'll build, it has to be sustainable, it has to be profitable for the company. At the same time, it should not rip off the customer, it should not rip off the patient, it should be social impact oriented, it has to be social impact oriented. I can give you multiple examples where I have, the product was about to go live and I have shelved it, or my co-founders have shelved it, because we figured that this is not creating the social impact which we want. This is actually the which is actually the opposite of it. And that's how we work at Ayush Pay. The whole team is focused on building impact, because we know if we are building impact and if we are building it sustainably, तो company बड़ी बनी जाएगी.
Yeah. Yeah, I think it's great. And if we talk about like awareness and to educating people about getting such services, like how they can get the benefit from them. So, according to you, what should be the initiatives that can raise awareness about among communities about it, and how it could benefit the most, and how can it reach the target audience, which actually require this?
So I don't think there is one answer which fits all. We have been, as I said, we have been experimenting a lot. We have partnered with a lot of NGOs, a lot of community to create more and more awareness among the community. We have done a lot of things. Uh, we have partnered with NGOs, we have partnered with communities, we have partnered with a lot of time. We have partnered with some companies also, which serve those communities. So it's finding right. I think it's finding right channels to market, because building your own channel is a long term process. You can't build it overnight. So I think it's a combination of both, NGOs, communities, and companies which are serving, or organizations which are serving those community. If there is a synergy, that works very well, and I think that is what we have been able to achieve as of now. And yeah.
Great, great. And like as we know that new innovations are always coming up for the social good and everything. So, is there anything like I mean, any upcoming feature or any innovation in Ayush Pay that specifically aim to address social disparities and gaps in the healthcare in terms of affordability and the good services?
Oh yes, definitely. We are launching few new products, new initiative soon. And when I'm saying we are launching, we are not only launching it from affordability point of view. We are also launching it from uh, enhancing the overall healthcare quality point of view also. So we all say on a regular basis that in government do not spend much from GDP on healthcare infrastructure and all that. But I think since a large part of it is private, the private community has to come up, because you can't compare India with US, you can't compare us with a Western country. The challenges are very different. Government has limited to spend in one particular category, I think. And since private organization has come up very well, infra upgradation is very important. And we are launching few products. It's in testing phase, but we are launching few products which will not only enhance the affordability, but will also ensure that the quality of care also gets enhanced.
Great. And I think you mentioned that you guys are not just the mediator, but also, and not provide just with the affordability, but also enhance the whole healthcare system. So, in the end, I would like to ask this conclusive question. So, looking ahead 5 to 10 years, how would you envision Ayush Pay contributing to broader social change in the healthcare sector? And what long term goal do you have to enhancing community for the overall well being?
From vision point of view, Ayush Pay, as I said, 47% of Indians spend out of pocket, and roughly 60 crore Indians do not have insurance. So one broader numbers is, I have to say, 2% to 3% of these consumer, basically 1.5 crore of these people, we want to reach out in next 5 years. That is our target, to at least serve 3% of the consumer, or the consumer base is there, or a patient base is there. And at the same time, also bridge the gap between insurance. There are a lot of services, a lot of treatment which insurance company also do not cover, and that also create a lot of stress, and sometimes pre-existing diseases are not covered and all that. We want to also ensure that whatever is being not covered under insurance also gets covered because of Ayush Pay, through zero cost loan, through any other means which we can. So we are building a lot of things around it. The whole focus is to reach to a crore plus Indians. The focus is to also fill the gap which insurance do not. And the larger goal is to also focus on awareness from preventive healthcare point of view versus sick care. So in India today, we are more sick care focused versus preventive care. तो कहावत है इंडिया में कि जब आग लगती है तब कुआं खोदने हम निकलते हैं. So that has to change in healthcare, because otherwise you end up spending a lot more, and your life expectancy, your quality of life also decreases, no matter how much money you spend in. अगर gall bladder निकल गया है तो निकल गया है. Your digestion issues will be there. You would have treated that, but it's more like a stopgap solution rather than a long term solution. So preventive care is very important. COVID के वक्त we saw some impact of that, but lately I am seeing that that's no more there. Only when there is a scare in the family, medical scare, then everybody gets aware कि हाँ हम भी diagnosis कराते हैं, हम भी ये कराते हैं, and then
Yeah.
eventually 2 months down the line everybody forgets it. So that is a challenge. And at Ayush Pay, one thing where we will build community is around preventive care, so that uh, more and more people can focus on preventive care rather than sick care. And obviously from sick care point of view, we will be covering a crore plus Indians. We will be trying to reach 2% of this base, and also cover whatever insurance company do not cover, provide quality treatment as well as affordable treatment at the same time.
Yeah, very well said, Mr. Agarwal. And I think you have covered the whole circumference into this. So thank you so
Thank you.
much for sharing your incredible journey and the impactful work you are doing with Ayush Pay and World Health Group to inspire here and hear about your commitment to overcome financial barriers in the healthcare space. So thank you
Thank you.
so much and all the best for Ayush Pay. And in the end, I would like to thank all the viewers and seekers who have joined us today for this insightful session. Thank you. Thank you so much.
Thank you. Thank you, everyone. Bye bye.
Yeah.